Hi, my name is Mark Olives, and today I'd like to talk about diabetes control. I work with a lot of diabetics, and I find that frequently they're unsure as to what their lab values actually mean. So they'll go to the doctor and they'll say, well, my doctor said that my A1C value is high, or my blood sugars are high. So today I'd like to give you a little explanation as to knowing or interpreting what your doctor is telling you, and also helping you to know how well your diabetes is being controlled. Probably the most common way that people look at their blood sugar and their control of their blood sugar is through their morning blood sugar values. Now, normal should be 80 to 100. Frequently, diabetics can run a little bit higher than that and feel perfectly fine. But generally speaking, you want your blood sugars in the morning before you eat to be very close to 100, if not below. So that will give you a day-to-day value. The A1C, however, is probably considered a more reliable value for gauging how you're doing with your diabetic control. And what your A1C value is it's registering how much sugar is on the hemoglobin molecules. And what hemoglobin is it's the iron component within the red blood cells that's carrying oxygen to the cells. For some reason, it also, in addition to liking to attract oxygen, it also likes to attract sugar. Your A1C value is the percentage of surface area on that hemoglobin molecule that's covered by sugar. So normal values, if you're non-diabetic, your A1C value should be between 5 and 5.6. 5.7 and 6.4 is considered pre-diabetic. 6.4 and above is considered to be diabetic. And again, that just means that, let's say you're diabetic and you've got an A1C of 7. That means 7% of that hemoglobin molecule is now covered with sugar. So we'd like to get that down. This is another thing that I like to tell people with the A1C value. The difference between, say, non-diabetic being at that 5 to 5.6 and diabetic being 6.4 and above, your percentage differential is very small. And to get diabetic, you simply traveled up the continuum until you hit the 6.4 and above. What we want to do is get it to slide back on down, get you out of a diabetic situation. And it's not that difficult to do with simple modifications. They say losing 10% of your body weight, controlling carbohydrate intake, not eliminating carbohydrates, but simply controlling them, and exercising regularly. If you can do those three things, you will greatly skew your numbers downward at an extremely quick rate. I've had patients that have had diabetic values or A1C values running up in the 14s and 15s. When your blood sugar is that high, your blood is very thick. You're at great risk for strokes, heart attacks, all kinds of problems and disorders. Even severe cases like that, in 3 to 4 months, making very simple changes, I've seen plenty of patients that can take that 14, 15 A1C and drop down into a rate at which they're at like a 7 or 8, which is a much more manageable state. And then as they continue to progress, they can progress themselves right into a non-diabetic A1C category. Some people are more predisposed to shifting back out. So you do always have to be careful. If you've gotten to be, if you had an A1C that produces or places you in an A1C category that you're diabetic, you do have a greater predisposition to trending that way again. But there's nothing that says in a lot of cases you cannot take it back down and be perfectly normal again. And that would be always my goal for people when I'm working with them, is to try and get their A1C down to a non-diabetic condition in which they don't have to take medications and that type of thing any longer. Another thing that's important to remember with the A1C values is that it is a 3-month average of your blood sugars, and that's why it's a better marker. It's not just a 1 day, it's a 3-month average. And this sometimes confuses people because they'll do really well. So let's say today you get your A1C tested and it's high. Let's say you're 8. So your A1C is 8 today. And you decide, I'm going to make some changes in my lifestyle and get things under control. So you do. You start to diet, you start to eat right, and you're exercising. And then your next A1C, let's say, is 3 months later. So you get it tested, and you test it, say, a 6.5. Well, some people are disappointed and they think, well, Jesus, I was working really hard. Why didn't my A1C come all the way into normal values? And I said, well, that's because you got to remember it averaged between 8 where you started and where you're at now. So you might be currently running around in the 5s, but if we average the 5 and the 8 together, it does produce that 6.5. So oftentimes you have to be patient and know that you're doing great. You've certainly trended down with your A1C, and now we're just waiting for that next period in which you can now get what would be a normal A1C value and place you in a condition in which you're not considered diabetic. So that's A1C and blood sugar in a nutshell. And again, exercise, eating right, and controlling the amount of carbohydrates you eat will greatly improve your success with getting those blood sugars and those A1Cs down where you want them. Thank you for your time.